Hello, hello, hello. Welcome to another episode of Off the Cuff with Cliff. As you know, our show, we break away from time to time and talk about subjects that have nothing to do with anything, but it makes you want to watch till the very, very end. You know I hate technology. You know I think technology is ruining the human race today. However, today I've got somebody that convinced me otherwise.
I'm Agatha. I am one of the oncology nurse. I've been a nurse for 30 years already. Technology, sometimes you love them. Sometimes you hate them. We cannot live without them. Right, Cliff?
Well, I don't know. There's certain things that I think is just destroying everything. I mean, when you see parents show up at a restaurant and just hand their kid a phone or something to do something rather than have a social interaction. But that's my feeling. However, the conversation you and I had the other day, you sort of convinced me that some technology has some good points.
Yes, it is have a good point. Think about right now the AI. How do you think your doctors one time read your films, x-rays, CT scans, the accuracy, you can find online, about 70%. What do you think AI will do?
Oh, AI is just changing everything, right?
Yes, 95% accuracy. Which one you want to get, and then they're faster as well.
So do we need less doctors now that we have AI that can...
Actually, some doctors is afraid they're going to lose their jobs.
And I guess that can happen, right?
Yes, it can happen.
So tell us about some of the technology that you use.
So I'm an oncology nurse. So right now, all the things is like totally online. Your electronic medical records. If you go into different hospitals, they come back, and then we can pull your records very easily. You don't have to remember anything.
So it's not like you have to go and carry those folders.
Yes, you don't have to carry those folders. All of the for patient safety, we use a scanner. Okay. Everything's scanned. If something's wrong, and then they're gonna give you a little block, which is like a good, right?
So that helps people's privacy.
Yeah. Well, this is another thing. Because everything's online, you don't want the things you get hacked.
Right.
Every year we have this HIPAA regulations everybody has to do. You kept your password kept it to yourself. Every 3 months, you need to change it.
Oh, yeah, I hate
that.
Yeah.
From 6 letters, right now, we have 12.
12 letters. And you have to put a character, a capital, and a number usually, right?
Yes,
I could never remember.
Not the number and that.
Wow.
So before, everybody had, right now, sometimes, when you go on vacation, you come back, you have to call the helpline because you forget your...
I'm always calling the helpline, yeah. And then it tells you it wants you to go to an app or something to authenticate.
Yes.
What the heck is it coming to?
Yes.
Let's go off the cuff for a second. You okay to go off the cuff?
Absolutely.
Okay. So those of you watching the show for the first time, we're going to go off the cuff and talk about something completely out of the ordinary, and then we're going to come back to the conversation. So I got a question for you. Mm-hmm. Do you like corn-on-the-cob?
Yeah, I like corn-on-the-cob.
Do you like the little tiny corns, or do you like the big corns?
I like the medium ones, not super big.
Of course, you're never going to go small or large. You're
Yes.
going to go medium, right?
You're
always in
medium.
the middle. Okay.
Yes.
So how do you eat your corn on the cob?
You eat corn on the cob. It has to be messy, right?
Okay.
You're going to eat it like this with your hands.
Or are you going to go left to right to left? Are you going to spin it, or are you just going to bite it in different places?
I usually will spin it. I think I go from left to the right.
Left to the right. Okay, do you know what that means?
What that means?
You're going to have to come back. We're going to go back to what we're talking about. We're going to come back, and I'm going to tell you exactly what that means, okay?
All right, that's awesome.
Okay.
I want to find out, too.
So tell me again. You have all this technology now. We have AI. Where do you see us 5 years from now?
From 5 years to now, I feel like a lot of there's probably like about microchips.
Okay.
I don't know if we implanted the human or not, but definitely we already use 3D printers.
Okay.
For to build the bones or everything.
What? They use a 3D printer to build bones?
Yes. Sometimes you can do the bone graft. Or you can have a metal things, in your body. Right now, they actually use a 3D printer customized to do certain things in your body part.
No way.
Yes, it is.
Wow.
It's already happening.
So can they do that with organs too, or organs because they're living?
Organs is a living, but right now, I think besides the brain, we can transplant everything.
Wow. So tell me about these chips.
So I think right now there's something underdeveloped. Maybe use microchips. Maybe the waves maybe stimulate your brains.
Okay.
So, but it's that's just a very early on. Right now we do a lot of cloning, genomics.
Wow.
It's already happening.
Wow.
You know?
So how come we
Yeah.
don't, how come the general public, or I shouldn't say general public, how come I don't know about that? I'm usually pretty caught up on all this technology stuff.
Well, for the medical, like a lot of things is a very controversy.
Okay.
Are you gonna? We already know for fact some of the embryo part can really help for the medical reasons,
Right.
but there's a lot of ethical issues.
Yeah, I can see that. I can
You
definitely
know,
see
and
the
then
ethical.
the
Yeah.
privacy issues,
Right.
Right, and the time you have a technology, they always have a dark side.
Yes.
If the system get hacked, what are you gonna do?
Right,
There
right.
is no electricity. What are you gonna do?
Right.
You know, when it go dark, this is a
Who controls all this stuff and oversees it? Like, if it's happening in the United States, it's happening in Canada, it's happening in Asia. Who's controlling what goes
Right
on
now,
in
we
dark
don't
space?
know.
We don't know.
We don't know. We don't know who controls what, and who there's a lot of big hole, like we call it a black hole in
Okay.
the web,
Okay.
right?
Right.
So, and then actually, I just recently find out there's this China is just making so much newer drugs.
Wow.
There's just so much usually United States do majority of
Okay.
medical research,
Okay.
especially like of drug development.
Okay.
Right now, China caught up with a lot of it.
Wow.
They have a lot of manufacturers or something. You know, the names that you know, like big names like J&J's or that. They have manufacturers in China.
Okay. So obviously, it's very, very profitable, right? So do you ever think there's going to be a black market for that stuff also?
There's a black market everywhere,
Okay, tell it like it is.
right? There's a black market anywhere. I don't know.
Okay, let's go back off the cuff.
Okay.
Okay. So you're telling me you eat corn on the cob and you like to make it messy. You
Right.
like
Yes.
very, very messy.
Yes.
You like it messy. So when you're spinning this corn on the cob, are you going from left to right or right to left?
I think left to right.
Why do you go left to right?
I just think it's easier, right? Like this way.
Like a typewriter?
Yeah.
And then you
like
turn
this
it.
way,
Okay,
right?
okay.
Yeah.
So are you left-handed or right-handed?
I'm right-handed.
Right-handed. Are you analytical or are you more artistic?
I'm not sure.
I don't know. It doesn't matter for this conversation anyway. I just wanted to know. Okay. So typically when you're doing that and you're turning it, do you leave corn in between or do you take all the corn off and then all the corn off, then all the corn off?
I don't leave a corn in between. All the corn off.
All the corn off. So you go left to right and you take all the corn
Yeah.
off. Okay. So what that's telling me is you're a very, very logical person, right? You
Okay.
like to have a starting point.
Okay.
You'd like to get to a finish and then
Yeah.
you like to come back. And
Yeah.
then you build on that.
Okay.
Do you turn clockwise or counterclockwise?
I think clockwise.
So you're
This way.
turning, you're going that way with it.
Yes.
Okay. So that's saying that you're building on something, right? So you're starting a row. It's like
Yep.
you're building and you're coming down. If you were going the other way, then that's saying you really don't know what's going to happen, but you're going to keep it going anyway. So that means you're an adventurer. So you're not an adventurer. You're a very boring person. You're a very boring person. Okay. Let's get back to the subject at hand. So technology is changing everything that we do. Doctors are afraid they're going to lose their jobs. Do you think that the requirements to become a doctor are going to be lessened also because of that?
I don't know. I don't know. I feel like probably more because you have to understand some more. You have to embrace with the technology, right?
Okay.
And it is helps. So, I'm a foreigner.
You're a foreigner?
AI definitely helped me to write.
Okay.
And then put my idea in a visible way.
Okay.
Which is the good part of the technology.
Right.
The bad part is, I can see it made a lot of people lazy. They have absolutely no idea what they're doing.
Right.
Because somebody helping them, right? So I feel like coin always has two sides.
Okay.
Good and bad sides.
Right.
I don't know how every new things that we have embraced, there's always have a dark side.
There's always going to be the flip side of it. You're right.
Yeah.
And there's always going to be somebody trying to figure out how to beat that, right?
Yes.
That's how I think. I always think, hey, if this happens here, something happens here.
Mm-hmm.
My father told me something, and what he said is, everything you look at, everything you touch, somebody made $1 million on it. I don't care what it is.
Yes,
Somebody made
it
$1
is.
million, right? So money's driving a lot of this stuff.
Mm-hmm.
Now, AI is altogether could be controversial. Some people love it, some people hate it, some people say it's cheating. But I think that's one of those technologies, to your point, is making everybody more of a dummy, right? So I read an article once on AI where attorneys were using it to do cases. So they get to trial, and the case had nothing to do with it because AI still makes mistakes. People just think because it comes from that technology that it's right.
No, it's not.
Well, couldn't the same thing happen, though, with medicine?
Yes, it is.
It is.
But the thing is, like, even AI look at the film, why certain doctors has to look at it again? It's true, there's more accuracy, all of that, but who builds AI?
I don't know.
We are, right?
Okay.
Humans build AI, you put in the data, if you put something wrong, and AI, they just present it to you.
Okay.
Right?
So we can have wrong data coming to us also.
Yeah, yeah. You know, what kind of things you build right, you know. So, like Rob, he's driving a truck, wherever the one-way road, they always tell the truck to turn around. Who built that? Because the people put in the data.
Right. Okay. Okay.
But
Yes.
I think it doesn't really matter good and bad. Every new thing is an opportunity.
That's true. Everything's an opportunity. Okay. An opportunity. We're going to go off the cuff again before we end this, okay?
Okay.
Okay. So we talked about corn-on-the-cob.
Yes.
We talked about how you're very, very sloppy with it. You want to make it all messy. We talked about how you read it from left to right like a typewriter.
Yeah.
We talked about the way you rolled it because you're always building onto something. And we concluded you're a very boring person. Okay? How do you make your corn-on-the-cob?
How I made my corn-on-the-cob?
Yeah, how do you make your corn-on-the-cob? Do you boil it? Do you put it in the microwave? Do you
boil it?
You boil it?
Yeah,
okay,
I boil it.
So what's your recipe?
I just boil it. What
Do you
are you talking
boil it with husk on or husk off?
Hucks on.
Hucks on. So you leave the and you boil it with it on. Okay,
Yes.
that's interesting.
Because by the time you boil the husk on, it's supposed to be have a more flavor to it.
Oh, interesting. I've never
Yes,
heard of
and
that.
then you do that.
Right.
But I like put the thing stick on it.
You stick the stick on it, yeah?
Yes.
And then you eat it like a Tootsie Roll Pop?
Yeah.
So you eat it like this, or do you turn it sideways?
Well, I eat it like this.
Okay. So do you put butter on it? Do you put salt on it?
I love to put butter on it. I can't do anything with that.
So butter goes on it. Okay. So that's a unique recipe. Have you ever tried having it with mayonnaise and Parmesan cheese?
No, but I know the Mexican street corn, they do put cheese on it.
They do put cheese on it. So
And then put a little bit of seasoning, which is very good.
yeah, they put the karaoke season or whatever, coyote
Yeah,
season
yeah,
or whatever.
yeah.
Okay, so that makes sense. So my recipe for corn-on-the-cob, I actually have two. I just discovered one like 2 weeks ago. So what I do is I just wrap the corn-on-the-cob. I take the husk off, wash the husk off. I don't like all them strings that get stuck in my teeth. Just put it in plastic, stick it in the microwave for 7 minutes, take it out, put mayonnaise on it. Globs and globs of mayonnaise.
Wow.
Then take Parmesan cheese and put Parmesan cheese on it. Let it sit for a minute or two. So what happens is the mayonnaise feels like it's, or looks like it's melting and it's going into the crevices, and then you start eating it. And then when you eat it, so you go row to row, row to row, row to row.
Yeah.
So Mitzi, my wife, she eats it. She goes here, 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 here. When I'm all done, when she's all done with it, I can take a knife and scrape it off and get a full can of corn at her. That's how she eats her corn. She's all over the place. I take the corn and I'm very, very sloppy with it like you. I have that and I'm just biting at it. I'm just going at it until eventually I get it all off. So that's the recipe. The newest recipe I just found, and I got this actually from AI.
Ooh.
I asked for
I didn't
different
know
ways to cook
AI
it.
can do recipes.
This is the recipe for corn-on-the-cob for AI. AI tells you to cook it in an air fryer. You take it and you put it in the air fryer for 15 minutes. You take it out for 1 minute, you put the butter on it. You put the butter on it, you put it back in for another minute, and guess what happens? It turns crispy. And when you bite into it, it's very, very crispy, but it's got so much flavor. It's almost like, and I'm sure it doesn't because scientifically it can't, it's almost like it absorbed the butter into the kernels of corn.
Oh.
It's a juicy, and it's incredible. So if you get a chance, try it that way. But anyway,
I will try it.
give it a try. So anyway, thank you very much for the technology and all that other good stuff.
All
Look
right.
forward to seeing you again.